Well, the government wants all adults to be offered a jab by the end of the month, but the knock-on effect on the health service will be that some patients will have other treatments postponed. At the Royal Blackburn Hospital, staff are trying to find ways to keep operations and other procedures on track. Here's our health correspondent, Jill Domergan, with the second of her exclusive reports.
In a trailer on a car park, Gordon Fairweather's getting an MRI scan.
I'm getting pain in my legs, and so they want to check whether the nerves are trapped.
Are you okay there?
He's at the Rossendale Health Centre, where 4 months ago they set up a mobile diagnostics unit.
I was told it might be a month, but much to my surprise it was 8 or 9 days.
The unit was set up to deal with a backlog of people waiting to get their health problems diagnosed.
We see around 20 to 30 patients a day. It's definitely helped with easing the pressures of hospitals and care centres, getting patients in a lot sooner than what they would expect to.
Since it's been here, this trailer's scanned around 2,500 patients, helping to deal with a huge increase in demand over the past few months.
We had a period where we had no referrals at all, or lower referrals, and now those have increased significantly. So we are seeing more pressure on the service as a result of attending GPs, etc. later.
That pressure's also being felt at the Royal Blackburn, where major elective surgery's carried out.
There has been a backlog of patients that have built up over the pandemic. I think critical care has been under immense strain for over 18 months now.
When critical care beds and staff are diverted to caring for COVID patients, there's a huge impact on people waiting for major operations. One of the big problems is that somebody having major surgery needs a much higher level of care when they come out of the theatre. But the number of critical care beds in any hospital is very limited. And so what often happens is that that bed ends up being given to somebody having a medical emergency and the operation has to be postponed.
There's a number of patients who are waiting for major operations, and operations which just can't happen unless they have the support of an intensive care bed afterwards, and the staff which accompany that bed.
Most people who've had surgery don't need full critical care, but they do need more help than they get on a general ward. The hospital's now set up a new enhanced care unit, meaning existing critical care staff can look after more patients.
I'll be honest, it's early days and we are still developing, and we will continue to develop over the next few months. We're doing a number of operations every single day with very few cancellations, and that's what's important to us.
The government says major elective surgery will continue through the vaccine drive, but there's another problem. Many of the patients this unit's seeing now are much sicker than they should be.
We have seen a number of patients who've put up with significant disease at home without medical intervention because of various factors. We will be under strain for probably many years to come, unfortunately. So it's about trying to ensure that actually we look after a whole cohort of patients.
In Rossendale too, the result of late diagnosis is becoming worryingly obvious.
Delay in patients has happened through COVID. Ultimately, patients have attended with more advanced disease, which is obviously not great in terms of the treatment options that are available to them.
Gordon's early scan is over.
Done and dusted. Pleased about that. Yes.
The results will come through in a few weeks. Now it's just a question of waiting. Jill Domergan, BBC North West Tonight, East Lancashire.